My name is Pirtle. I'm the Chief Medical Information Officer here at West Tennessee Healthcare, and also I'm an internal medicine physician at the Lift in downtown Jackson. Telehealth visits are available for anyone, depending on your needs, obviously. I would actually push you to call your physician's office or nurse practitioner's office to start out with, mainly because some telehealth visits are more custom for telehealth encounters specifically, such as rashes, upper respiratory infections, things in that world, versus having chest pain or abdominal pain. This may require more of a visit, an inpatient type visit. So whenever you do call your physician's office, the process is pretty streamlined, but the scheduler and registration desk will send you information. So the scheduler would get you a formatted email and send you an email with the information that you need to do that conference. It'll also have an attachment on that email about how to download the app. And literally you would just download the app, type in your name, and when your appointment's about to be ready, you would just log in maybe 5 minutes beforehand to go ahead and make sure everything's working, and you would enter a virtual check-in environment. And at the time that the provider is there, he would let you in the room, and you have a discussion with whomever that physician or provider would be. They would ask you the same questions about your symptomatology or past medical history. The goal is to provide the same type of care you would have in an inpatient environment, in a virtual environment. You would need either an iPhone, Android device. Also, you can do it on an iPad or any type of tablet, like a Samsung tablet. And finally, you can even do it on your desktop or laptop. Anything that has really video capabilities, a webcam, anything like that. And if not, we also are able to offer something like phone visits only, if that's something that you don't have. The best way to frame this is that just to have you call your physician's office or your nurse practitioner's office, and they can get you set up with the specific software you need. Currently, we're using 2 different vendors, one being Zoom. The other one is a product called Telehealth. It basically just takes literally just downloading the app, entering your name, and that's the gist of it. Make sure you download the app early on and that it works fine. Probably the most important thing is to get in your visit probably about 5 to 10 minutes early. It's just to have, whenever you do have that candid conversation with your physician or your provider, that it doesn't take a few extra minutes of troubleshooting, if you will, the reason why the mic doesn't work and things like that. Long story short, copays still may apply, but typically in this climate right now, most of those are waived. But copays could still apply, and obviously your insurance company, depending on what that insurance is, if it's Cigna, Aetna, Medicare, would be billed for the telehealth visit. And you do have any questions about that, whenever you do call your physician's office, just ask them and they can give you more information regarding that. It's probably most important right now, especially with the COVID environment we're currently in. We're trying to keep sick patients out of the office if we can, and also well patients, just so we don't have any type of, people don't have a chance of capturing any type of infections or anything like that from others that may be waiting in the office, especially patients who are at higher risk of having issues, such as people who have COPD, who had recently had transplants or immunocompromised and things like that, and also your access and convenience. So most importantly, I think here is that this is obviously a video interview with a limited physical exam, but we can always at any time, if your provider feels that they need to do a strep test or a flu swab or whatever that would look like, or even blood work, he could ask you to come into the office for just a lab visit, or he or she could reevaluate you at that time. This is an easy way to provide access, decrease travel time, decrease wait time, and also provide a great standard of care. After the COVID peak is over with and life comes back to normal slowly, we will continue to offer telehealth visits with all of our clinics, and also primary care, specialty care, and urgent care visits. So I just want to thank everyone for their time and loyalty with West Tennessee Healthcare, and we look forward to serving you virtually and also face-to-face in the near future.